Night falls fast out here. You're miles from help with a deep cut on your leg that won't stop bleeding. Your heart races as you realize proper treatment can save you, but the risks are high if not done correctly. First, apply direct pressure to the wound using clean cloth or gauze from your pack to slow down blood loss. If available, elevate the injured limb above your heart and use a tourniquet only as a last resort when direct pressure fails and there's significant bleeding. Ensure you have adequate supplies like bandages, antiseptic wipes, and pain relief medication. Proper wound care is crucial for preventing infection and promoting healing, but seek professional medical help as soon as possible. You rip open your emergency kit and start sorting through the essentials: bandages, gauze, antiseptic wipes, painkillers, and more. But which of these will really make a difference when it comes to treating that deep wound? First, apply direct pressure with clean cloth or bandage to stop bleeding. Elevate the injured area if possible. Once the bleeding stops, gently clean around the wound with antiseptic wipes or boiled water. Cover the wound with sterile gauze to protect it from infection. Painkillers can help manage pain, but they won't heal the injury. Always seek professional medical attention as soon as possible. Every item has its place, and every mistake can cost you. Remember, local laws may restrict certain treatments or require reporting of injuries in some areas, so be aware of these regulations. Here, what keeps you alive. Treating that deep wound right now is crucial to prevent infection, which could seriously jeopardize your survival. Clean the wound with purified water if available, and use sterile bandages. Remember, proper care requires knowing local laws regarding medical supplies in wilderness areas. Seek professional medical help as soon as possible. Step 1. Stop the bleeding. The first thing you need is to slow down the blood flow. Press firmly on the wound with a clean cloth, bandana, or any clean material if that's all you have. Keep applying direct pressure until the bleeding slows and stops. If it doesn't stop within 10 minutes despite constant pressure, apply additional layers of dressing and elevate your leg above heart level to reduce blood flow. Always seek medical help as soon as possible, even after stopping the bleed. Do this right and you could save yourself from severe blood loss or infection. Get it wrong, and the risk of complications like shock or infection increases dramatically. Step 2. Clean the wound next. Clean the wound with purified water if you have it. If not, find a source of water, like a clear stream, and boil it first or use purification tablets to make sure it's safe. Rinse away dirt and debris gently. Scrubbing harshly can worsen the injury. Once the area is clean, use antiseptic wipes to disinfect it carefully. Swab gently around the wound, being cautious not to tear any skin further. This step helps prevent infection, which can indeed be dangerous in the wilderness, as untreated wounds can lead to serious health issues like sepsis or tetanus. Step 3. Dress the wound now. Cover the wound with gauze and secure it tightly but comfortably. Wrap it snugly like a bandage to keep out dirt and bugs. You might need tape or strips of cloth to hold it in place. If you have a compression wrap, use that as well. It helps control swelling and can reduce blood loss. However, be cautious not to apply the wrap too tightly, as this could restrict circulation. Always seek medical help when possible and stay aware of your surroundings to avoid further injury or infection. Step 4. Pain management. Take painkillers if you have them. Ibuprofen or acetaminophen can help manage pain and reduce inflammation. Follow dosage instructions on the bottle. Overdosing can lead to serious complications. If no pills are available, consider natural remedies like willow bark tea for pain relief, but avoid using any plant without positively identifying it with an expert guide or field manual. Incorrect identification of plants can lead to poisoning, which can be more harmful than the initial injury. Step 5. Keep it clean now that your wound is dressed. Keep it clean by changing the dressing daily or whenever it becomes wet or dirty. If you're stranded in the wilderness longer than anticipated, use alcohol wipes from your first aid kit to disinfect the area regularly. Boiling water can also be used if you have antiseptic powder or solution to mix with the cooled boiled water for an additional cleaning agent. Always ensure that any water used is thoroughly purified to avoid infection. Step 6. Monitor for signs of infection. Watch closely for signs of infection such as redness, swelling, warmth, pus, or fever. If you notice these symptoms, act quickly and seek medical help immediately if possible. If you have antibiotics in your survival kit, use them only according to the instructions and ensure they're appropriate. Infections can spread rapidly if a wound isn't properly cared for, so treat it as a medical emergency. Regularly check the wound every hour, ensuring it remains clean and dry. Always carry proper first aid supplies like sterile dressings, antiseptic solutions, and pain relievers. Step 7. Stay hydrated. Drink plenty of water, even more than usual. Staying hydrated supports your body's ability to fight infection effectively. Dehydration can slow down the healing process and increase the risk of shock. So drink up, but remember that hydration alone isn't enough for treating a deep wound. Cleaning and properly dressing it's crucial too. Always purify water before drinking in the wild to avoid pathogens that could worsen your condition. Step 8. Rest and stay put. Rest as much as possible. Moving too much can reopen wounds and worsen injuries. Stay put until help arrives or until you're certain moving will not cause further harm. Use your shelter to stay dry and warm, which reduces the risk of hypothermia and infection. Ensure any water you use for treating wounds is purified first to prevent infections from pathogens in untreated water. Step 9. Signal for help. Use your signaling devices, such as whistles, mirrors, and flares to attract rescuers. If possible, set up a large signal fire. Do not attempt to move with an open wound unless it's absolutely necessary and safe to do so. Stay put until help arrives or conditions improve for travel. Signal early and often. The sooner someone finds you, the better off you'll be. Rule of thumb. Treat it right. Remember this one crucial rule. Treat your deep wounds immediately and continue to care for the injury daily until help arrives or you're confident it's safe to travel without worsening the condition. Neglecting a wound can lead to severe infections, so stay vigilant and keep the area clean with proper dressings from your first aid kit. Real-life scenario. Let's imagine you're out on a hike when disaster strikes. You slip and fall, cutting your leg deeply on jagged rocks. Blood soaks through your pants in seconds. Night falls fast and help is hours away. You know the steps now, but panic might set in. Remember, this is educational only. Foraging, hunting, and fishing carry real risks and are governed by local laws and seasons. Always verify plant and animal IDs with an expert. Follow your local regulations, and never eat anything you can't 100% identify.